There's been a lot of conversation lately about peptides, not just in wellness clinics or sports medicine, but in podiatry as well. And whether you plan to use them in your practice or not, the reality is this: your patients are already asking about them. So today I want to talk about how peptides fit into the podiatry world, what patients expect when they bring them up, and how they can complement the treatments you're already providing. As podiatrists, you're dealing with chronic soft tissue injuries every single day: plantar fasciitis, Achilles tendonitis, stubborn post-op recovery, and long-term inflammation. And the appeal of peptides is pretty straightforward. They support the body's natural repair pathways. Patients hear phrases like collagen support, reduced inflammation, and faster recovery, and naturally they're curious about whether peptides can help with their heel pain or tendon issues. Now, peptides are not a standalone solution, and they're not replacing anything you already do. But for many practices, they're becoming an option that fits alongside shockwave, laser therapy, physical therapy, and orthotics. What peptides really do is help reinforce the repair process, making patients more compliant, more hopeful, and in many cases, more committed to the entire treatment plan. If you do decide to talk about peptides with your patients, clear communication is everything. They don't need complex biochemistry. They need simple, compliant language like, peptides may help support tissue healing. They work with your body. They don't override it. They're part of a broader treatment plan and not a quick fix. This sets the right expectation and keeps the focus on clinical decision making. And if you're thinking about integrating peptides into your practice from an operational standpoint, your team has to feel confident talking about them. A short training can go a long way. You need to help them understand where peptides fit into the treatment plan, how to explain them in plain language, when they're appropriate and when they're not, and what questions to ask before escalating to the doctor. When your team is aligned, patients get consistent, clear messaging, and that builds trust. So whether you're already using peptides, considering them, or just want to stay ahead of the conversation, the key is this: peptides aren't replacing traditional podiatric care. They're about complementing it in a thoughtful, evidence-guided way. Patients are curious and they're doing their own research. They're looking to you to help them make sense of it.